We've seen a perfect storm of factors come together to lead to complex challenges in the space of children's social care and education at the moment. The incoming government have got a number of competing priorities to focus on in the short term. We've got a fragmented care system which is struggling to meet the demands of families and young people. We've also got local authorities increasingly struggling to find appropriate placements for children, and the cost of those placements are increasing. We've got a shortage of high quality teachers, and also inadequate supply of early years provision to meet the needs of our current government-funded childcare offer. But this is a potential moment of change. Labour have made a number of promises in their manifesto, particularly in the space of devolution and prevention. They're promising 6,500 new teachers, 3,000 new nursery places. They've guaranteed a number of new prevention initiatives, including free breakfast clubs in all schools and supervised toothbrushing. They want to provide all children with access to mental health support, both in schools as well as in the community as part of Youth Futures hubs. And they're looking to create neighbourhood health centres where they can bring together a number of different services under a single roof to provide more holistic support to young people and families. Behind the scenes, Labour have made a number of promises for key enablers as well, including workforce and training plans for the health and social care sector. They are promising multi-year funding settlements for councils, which would enable them to plan out their provision more sustainably going forward. And they're also promising the introduction of a new single unique identifier for families and young people between different services to enable more joined up support. We're expecting to see a real lag in the time of which some of these new initiatives are going to have an impact on people in need, particularly where we're talking about initiatives that are going to impact workforce. However, we've seen lots of local authorities do a fantastic job of mitigating their financial pressures by focusing on early intervention, prevention and management of their front door. We could see a real impact on people in the short term if the government chooses to take this more people-placing care approach. A people-placing care approach could have a huge impact on some of these challenges that we've spoken about. Some of these national solutions that they've proposed, we then need to think about how they're applied at a local level, harnessing the power of local networks, local understanding, and building on the strengths that already exist in provision in that space. We should then be able to see a real shift in the quality of services that are delivered for young people and families, and also a reduction in the pressure that we're seeing on these high intervention services.